Hello, so today we will be talking about another important concept. If there is a nephrotic syndrome patient and that patient presents to you with sudden onset flank pain and gross hematuria, this should point out towards renal vein thrombosis. So, what exactly happens here? In case of nephrotic syndrome, the patient is going to lose a lot of proteins, and along with that, he's also going to lose antithrombin 3, which is basically an important anticoagulant. So since he is losing this patient will have a hypercoagulable state. So any patient who has nephrotic syndrome is automatically at high risk of developing any of these thrombosis, right? And if this patient is suddenly coming to you and he's saying that he has a sudden onset flank pain, that means that there could be some thrombus in some part supplying to the flank, which is your kidneys. So it could be renal vein thrombosis. And why do you have this gross hematuria? So if you assume that this is your vein and there is some thrombosis here, so there will be a lot of venous congestion here, and because of the congestion there'll be a rupture of small capillaries and there'll be ischemia, and because of ischemia, there will be bleeding. So there's gross hematuria and there is sudden onset flank pain, and sometimes you can see that there is increased LDH because of ischemia. Now diagnosis, since it's a problem with the veins, you will do CT, MR, angiography or renal venography. And how do you treat this? So the problem is that there is a thrombosis, so you are going to give anticoagulation, especially warfarin. But if you are thinking that the patient is at high risk of developing AKI because of circulatory issue, you can go for urgent clot removal.